So today we are going to discuss a long vignette question, how to approach this long vignette Uworld question, and how to get to reach to this understanding of this question and how to answer this long vignette question. You can see I have got it wrong, but you can see. Now let's dip into the stem of this question. It is designed to compare the effect of brown rice vegan diet to a standard diabetic diet on glycemic control. So you see, we are comparing brown rice vegan diet to a standard diabetic diet. So highlighting the thing is a good way, like you just to increase the focus. Now you see it's just a comparative study design question. Now you can look at the methods upon randomized control trial at blinding. Once you sing along with the question, always go scroll down to what they are asking from you. So you can see that based on the abstract, which of the following conclusion is the most appropriate. Now you see that they are asking for the conclusion, so you will focus on the table of this your question, and then you will ask in this question in this table. Now method is showing upon randomized trial without participant, with the upon randomized control trial with participants are blinded and the follow-up are 0 and 12 weeks, and you see that how many patients were included. 118 patient in type 2 diabetes mellitus. Inclusion was age 30 to 70, or taking oral antibiotics for more than 6 months. HbA1c level 6 to 10%. Exclusion criteria was increase in dose related agent, antibiotic for past 3 months. Like exclusion criteria was increase in dose of anti-diabetic agent. So if those patients will increase their diabetes, so they are excluded. So the simple thing is like intervention was like 118 patients so divided into two groups of 59 with vegan diet and the 59 with standardized diet. Now compliance reporters on a self-assessment dietary record. The record was self-assessment, and you see that you can see that the self dietary record and outcome primary endpoints or HbA1c was compared to 0 and at 12 weeks. So secondary endpoint of the change in BMI and waist circumference were measured. What we measured was a change in BMI, and what else we measured? We waist circumference. So now an expert of 0 to 12 change in is shown 0 12 weeks. Now you can see that their vegan diet table and this standard diabetic diet table. Now we want to check which diet is better, the standardized diet which has been followed from the hundreds of years, or the new diet vegan which is discovered now. So the data comparison was done on 0 and 12 weeks, 0 and 12 weeks. Now we have a primary endpoints. At the vegan diet, the HbA1c were 7.7 plus minus 1.3, and vegan 12 was 7.1 plus minus 1.3. So you see, vegan diet was followed that the HbA1c was reduced from 7.7 to 7.1. With a range of minus 0.5 plus minus 0.8. This is, we can say that this is a standard error, right? On the standardized diabetic diet, 0 was 7.4 HbA1c, and after 12 weeks it become 7.2. Its standard is this. Now HbA in all participants. HbA1c, we see that the HbA1c participant, in those participants with greater than 90% compliance, we saw that the results were in all patients the first line, and these were the results in those patients who are really compliant, to the data. So you see that the HbA1c was initially 7.2, then it reduced to 6.6, and when the standard diabetes it was 7.4 to become the 7.2. So we saw that the vegan diet when the compliance was more, we saw a big difference. Why? Because the patient were a lot more compliant to this vegan diet, and they strictly followed the 4 protocols. Now in secondary endpoints, in primary endpoint we check the HbA1c, secondary endpoint we check the BMI and circumference. So waist circumference and BMI were the secondary endpoints when measured after 0 weeks and after 12 weeks. So at 0 week it was 23.9, and then after 12 weeks it was 23.5. So it got reduced by 0.4. But in standardized it was 0.23 and 23.1, and it is very slightly decreased 23.1 to 23. That's 0.1 difference. But those who waist circumference were followed, waist circumference 84 centimeter, then 81, almost 2.1 centimeter difference, and with this standardized 82.3 to 81.5. So we see that it is 1 point something, 1.8 plus minus 0. Values are mean standard deviation, primary point. We see that the vegan diet has a lot huge difference as compared to the standard diets. You see, the one, this is 0.5 difference as compared to this, and this is, oh, the difference is in BMI is 0.5. This is difference is 2.1. Land ini dilepas. ټول نه لپاسه تاخ کې پراته دي کنه، ټول نه لپاسه تاخ مالند لپاسه څخه جوړه څه خبره ده، لپاسه تاخ کې پراته دي کنه، ټول نه لپاسه زموږ دي د لاندې نه بزول په لپاسه کې جوړه نه لا په لپاسه تاخ کې خو غټه تیلې پراته ده څه دا کاشف دی Okay, guys, sorry for the mid-week interactions. Okay. Now we saw what we are seeing that it is long vignette question, and but the weekend that the comparison was that we lost a lot of weight with this vegan diet as compared to the standard diet. Now what are they asking? 46-year-old for women with type 2 diabetes mellitus, standard diet, oral antidiabetics. For the 8 months, BMI is 25, waist 83. You can see the patient recently read about this vegan diet. I want to be on this diet. Expert from the study abstract is shown. Based on the abstract, which of the following conclusion was appropriate? But we saw that we can recommend the vegan diet as it has a lot of good things. So baseline difference in the waist circumference between the participant vegan and standard groups makes the comparison unreliable. Or does it make unreliable? 84 to 81 and 82.3 to 81. No, it is reliable because the waist circumference has decreased statistically significant. Now compared with participant in the standard diet groups, participant in the vegan group had a greater statistical significant reduction in BMI. Absolutely, it has from 23.9 is to 23.5 is 0.4 difference, and in this it is just 0.1 difference with the standard diet. So there is a lot of difference with the vegan diet. So I have chosen this. None of the participants B00 reported later demonstrate any clinical significance. Why I have reported? Because I thought that at 0 and 12 weeks are too short time to determine the efficacy of a test. So this was a wrong approach to that I followed. You can see that you have to rely on the table and the results you have been given. Whatever the test is, whatever the time period is, just follow the statistics whatever they have given you, and what they are asking. They are asking us for the statistically derived test, statistically derived results, and they are asking us about the statistical things like comparison of the BMI. Which is there a significant difference? Yes, there is a significant difference with the vegan diet as compared to the standard diabetic diet. So we have to choose this answer. Why not DD? Only participant with greater than 90% compliance who followed a vegan diet showed a statistical significance in the HbA1c at 12 weeks. So with those who have strictly followed 7.2 to 7.6, this is also very huge difference, but 7.7 to 7.1 is also a good difference. You can see in both groups it is significant. So this is also wrong. So how the simplest way to a long vignette question here you have to be to give extra time to this question, and you have to divide the patient to two groups, and then you have to look at the table, and then you have to check the data, mark it how much they are significant, and then you have to check your questions, based the options, and then you have to make it wrong, that this highlighted, or to remove it from answers, there is the baseline differences in waist circumference in vegan diet, and the standard types unreliable. So this unreliable word, you have to check whether is it true or is it wrong. So waist circumference, you checked it and there was significant difference, and here it was also significant difference. So it is reliable, and you have to trust. So this is also wrong, and you have to trust the statistics, and you have to follow those steps. So I will re-summarize these. Just read the first few lines of the test, to compare the brown vegan diet to a standard diet. Then they have done the follow-up periods, and it was a trial, randomized trial, blinded, and two groups, and on diabetic patients, and they have given a table. And then what are they asking? They are asking for a patient suggestion. So they are asking for a patient suggestion. So now you have to read one line and then read the table. Then once dipping into this conclusion, you have to read the table once, and then you can answer the question. You can answer the question very precisely. That's all. Thank you.